Okay, I've started recording and we can get started at 7 p.m. Did you let everybody in, Heather?
Usha is now in control of letting people in.
Perfect. Thanks, Usha.
And
Okay,
I've been
good
off
evening,
prepared.
everyone. It's such a pleasure to welcome you to our second Alberta Wide Nursing Rounds. My name is Lindsay Komar and I will be your moderator for this Zoom session. Alberta Wide Nursing Rounds builds on the foundation of our long-standing citywide nursing rounds, an initiative that has connected nurses, students, educators, and researchers here in Edmonton for many years. But now we're share knowledge, raise.
Recording started again. Please
Oh,
record.
I got it now. Sorry, everybody. We're just recording now. So these rounds are about more than just sharing findings. They're about tackling the real-world issues you face in clinical practice and celebrating the impact of nursing scholarship. So before we begin our session, I would like to take a moment for a land acknowledgement. The Faculty of Nursing at the University of Alberta is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to enrich our vibrant community. We recognize the First Peoples of this land, and we commit to working together toward reconciliation and equitable health outcomes for Indigenous communities. So just a couple quick housekeeping items before we begin. This session is being recorded, and we ask that you register for the sessions to get the recordings, and we'll send them to you by email. And then I think, Heather, we are posting them on a website, but I'm not totally sure about that. So be sure to register if you want to get the recording. Also, we have Dr. Joanne Olson here, who's the professor and vice dean of our faculty, and she's helped us organize this session. And so before we start, because we're really talking about the International Conference of Nurses, and so I'm hoping, Joanne, you might give us a quick little background about the ICN conference and why this matters for nursing. And then after that, we'll kind of hear from our other presenters who attended the conference.
Thank you, Lindsay. Yes, as Lindsay said, I'm Joanne Olson, the Vice Dean in the Faculty of Nursing, and it was my great privilege to attend ICN this summer in Helsinki, Finland. And because we as the faculty knew that many of our graduate students and faculty had submitted abstracts that had been accepted, we found a way that we could help some of them financially. I believe there were 10 that we selected that were able to partially be funded to travel to Helsinki. So when I got there, they were there, and a number of faculty that had found their own way there. We had a very healthy contingent from the University of Alberta. ICN, International Congress of Nursing, brings together nurses from all over the world. About 7,000 of us gathered, and that's a large conference, but there was something for everyone. And what we've decided tonight to do is just to invite a few people who did go to the conference on behalf of the Faculty of Nursing and have them share what they presented in their work, and also maybe to give us a few highlights of what they learned from this experience. And I know it'll be enjoyable. And we've also got Dr. Patrick Chiu, one of our assistant professors, who will give an introduction to ICN, far more in-depth than me. And he'll also close up by talking about a leadership opportunity that ICN offers. Thank you, Lindsay.
Great. Yeah, so just like Joanne said, we're going to hear from one professor and 3 students, all at various stages in their careers. And all of our presentations have been pre-recorded. So what we're going to do is hear from all the presentations, and then we'll be able to have a bit of a conversation afterwards. We may not be able to have a lot of a question and answer session just because some of our presenters weren't able to attend. So first, we're going to hear from Dr. Patrick Chiu, an assistant professor in the Faculty of Nursing at the University of Alberta. His research focuses on the health workforce and professional regulation. He's a certified global nurse consultant, an alumnus of ICN's Global Nursing Leadership Institute, and a former United Nations liaison for Sigma Nursing. Patrick will give like Joanne said, Patrick will give a brief overview of the history of the ICN, Canadian nurses' connections to the global organization, and the Global Nursing Leadership Institute. So Heather is now going to play the video for Patrick.
Sorry. Not coming up, sorry. Okay, we're having problems with audio. Just a second.
I did see you were muted before you went into screen view. Down at the bottom there, the audio button was through.
Yeah, Heather, I think it's important that you don't mute yourself.
I just took off my video. My audio says it's on. So
So if you look at the screen there where you've got your cursor, go to the right, see the audio button there? Right by the CC button.
Yeah, if you
Yeah.
hover over the video, again, just right in the center, it should pop up again, and then just like scroll down and to the right, and there's a little, yeah.
okay, there it is. Okay,
Perfect.
sorry. No, sorry about that. Technical issues.
No worries.
Hello and welcome to October's Alberta Y Nursing Rounds. My name is Patrick Chiu. I'm an assistant professor here in the Faculty of Nursing at the U of A. And it's our pleasure to be able to spend some time with you tonight talking about our experiences attending the ICN Congress back in June in Helsinki, Finland. So today we're going to have 3 students provide a few presentations talking about their experiences. But before we get to that, I thought it would be useful to share some information about ICN for those of you who may not be too familiar with the organization or familiar with Congress. And at the end, I'll also share some information about their Premier Leadership Institute, which I had the privilege of being a participant in back in 2017. So ICN, also known as the International Council of Nurses, it is actually the largest and oldest nursing organization worldwide for healthcare professionals. So this idea of an international nursing organization was proposed by a nurse, a British nurse by the name of Ethel Bever Fenwick in 1899, while she was attending the Congress of the International Council of Women. And the idea was to create a space where nursing specific issues could be discussed. The initial goal was to establish a network of nurses associations from different countries in order to strengthen nursing education and practice. And so in 1900, they established the organization's constitution. That's when the first officials got elected to the organization. And in 1901, they held their first Congress, and their first ever resolution was all focused on advocating for nurse registration. So we've come a long way since 1901. ICN was also one of the first non-governmental organizations to be granted official relations status with the World Health Organization. So an organization that has an extremely rich history in terms of advocating and strengthening nursing as well as global health. If we fast forward to today, ICN is a federation of over 140 national nursing associations. So for us as Canadian nurses, we're represented through the Canadian Nurses Association. And what that means is that through our membership with CNA, we are part of this global network of 30 million nurses worldwide. For those of you who may be interested in learning more about the history, there is a book titled The Global Voice of Nursing that ICN published, and it is a detailed account of the organization's history from 1899 to 2022. Many people may not also know that ICN has been heavily shaped by Canadian nurses. You'll see some names here on the slide, but we do have past presidents, past vice presidents, a former CEO, chief nursing officer, as well as board members, past and current, who are Canadian nurses. Several staff and consultants are also Canadian nurses, and we also have within our faculty soon to be 3 Global Nursing Leadership Institute alumni who are, of course, Canadian nurses. The Congress occurs biannually, and it's really a forum to connect with old colleagues, to build new networks and collaborations, to learn from colleagues doing research around the world. It's also an opportunity for us as nurses here in Alberta and here in the Faculty of Nursing to share the world-class research that we're doing right here at home. And this year we were very proud to have a strong delegation of 12 representatives from the U of A. We had faculty, teaching staff, undergraduate, as well as graduate students. And we were also specifically pleased to be able to partially support some students whose posters and oral presentations were accepted into the scientific program. So here you'll see some photos of some of our present and past faculty, as well as some of my colleagues through the Global Nursing Leadership Institute, and some snapshots of our presentations and posters. So since Congress is such a unique experience that not all nurses get to experience, we wanted to provide our students with an opportunity to share their experience and also lessons learned to inspire those who may be interested in attending the next Congress, which is actually in Taipei. So we'll hear from 3 students today, and as I mentioned earlier, I'll close the session by talking a bit about the Global Nursing Leadership Institute, which is a really great opportunity for senior nurse leaders who may be interested in a leadership professional development opportunity. So we'll hand it over to the student presentations.
Great. Okay, so our first student presenter is Zahra Kanji. Zahra is completing her Master of Nursing in the Education stream. She brings extensive experience in teaching and leadership from Pakistan, where she served as an instructor. Zahra will discuss the findings and implications from her study with 21 undergraduate nursing students who completed an educational intervention using low-fidelity simulation to learn about and apply the BFIT post-operative mobilization program.
Hello, and welcome to October's Alberta Y Nursing Rounds. My name is Patrick Chiu. I'm an assistant professor.
I got kicked out, so I'm sorry.
Don't worry. It happens to me all the time. And just make sure you unmute it, Heather.
Hey, I'm trying to share this and it's not coming
Yeah,
up.
it looks good. If you just go down and unmute it, it'll be ready to play.
I'm not seeing it yet, so.
Oh, we can see it. Yeah.
Good, okay. It makes one of us. Okay.
I'm sorry. I know. Zoom sharing is super stressful, no matter what, how many times you do it.
You can see the screen?
Yes, we can. And then you just have to unmute down there. Yeah.
I did do a rehearse on this, and for some reason I'm not able to do this. Just a second.
Wide nursing rounds.
Sorry.
Earlier this
Now everybody can see.
Hello everyone, and thank you
Yeah.
for being here. I am honored to present at the Alberta Wide Nursing Rounds. Earlier this year, I shared this research at the ICN conference, Connecting with Global Nursing Leaders. Today, I'll walk you through key findings from my study and insights that continue to shape my thinking around nursing education and mobilization-focused care. My name is Zahra Kanji, and I am completing my Masters of Nursing in Education stream at the University of Alberta. I bring an extensive experience in teaching and leadership from Pakistan, where I served as an instructor and acting principal at the Sindh Institute of Urology and Transplantation Nursing School. My passion lies in helping nursing students gain confidence in their skills and helping students bridge their classroom learning with safe clinical practice. Before I move forward, I would like to acknowledge that we are situated on Treaty 6 territory, the traditional lands of First Nations and Métis people. My current research focuses on exploring the feasibility and acceptability of BFIT using low-fidelity simulation on nursing students' knowledge and confidence in promoting early post-operative mobilization. Early post-operative mobilization is a critical nursing care activity that significantly impacts patients' outcomes. It reduces complications, increases functional independence, shortens the length of hospital stay, increases quality of life, and reduces costs. Despite these benefits, post-operative mobilization is often delayed. Research indicates that delayed mobilization can lead to various complications such as pressure ulcers, chest infections, and deep vein thrombosis. These complications not only increase healthcare costs but also adversely affect patients' lives. Therefore, it is imperative for nurses to ensure timely mobilization of patients post-surgery. At the ICN conference, a research study was presented that surveyed over 3,500 nurses across 35 Danish hospitals. The findings showed that 44% of essential nursing care is often missed, with ambulation being the most frequently missed activity, that is 69%. In Canada, nurses face similar challenges like short staffing, heavy workloads, and competing demands. Because of this, they often have to shift priorities, which means some important tasks like ambulation get missed. This shows how system-level issues affect patient care even when nurses want to do more. The solution is to find a method that helps with these exercises without adding to the nurse's workload. One such approach is BFIT, which stands for Bedside Exercises for Hospital Fitness. BFIT is an evidence-based functional exercise program that helps patients mobilize safely, prevent common hospital complications, and get home sooner. BFIT consists of bed-based, chair-based, and standing-based exercises. Nurses have to assess the patients for the appropriate level of BFIT and teach these exercises using double-sided printed cue cards. Once these are taught, patients can perform these exercises on their own 3 times a day. The benefit of such an approach is that nurses only need to confirm if the patients have done with their exercises 3 times a day. This slide shows the BFIT cue cards. It uses color coding, simple language, and clear figures so that patients can easily follow these exercises on their own. BFIT is also available as an app. The app shows demonstrations of each exercise, reminds patients when it is time to do the exercises, and helps track their progress throughout the day. For more information, you can scan the QR code or visit the link shown on the slide. To explore the feasibility and acceptability of the BFIT program, I used a single group pre-post design across different undergraduate nursing streams at the University of Alberta. To assess the impact of the intervention, I administered pre and post surveys measuring changes in students' knowledge and confidence. The intervention was delivered in a 2.5-hour classroom session using the NLN Jeffrey simulation framework. I began with a 15-minute didactic presentation introducing the BFIT program, followed by a scenario-based low-fidelity simulation. In the first scenario, students practiced introducing BFIT to patients and teaching them how to use the cue cards. The second and third scenarios focused on common barriers such as pain and reluctance, giving students a chance to build communication and clinical judgment skills in more complex situations. My study involved 21 undergraduate nursing students from different program streams at the University of Alberta. Most were young, female, and early in their nursing education. Many had some healthcare experience, mostly in auxiliary roles, but few had worked directly with post-operative mobilization. 2 students participated online rather than in person, so their experience of the simulation may have felt different. After the simulation, students showed a clear increase in both knowledge and confidence. Even though participants already had increased baseline knowledge, the session helped deepen their understanding and made the content feel more applicable to real clinical situations. Many felt more prepared to support patients with early mobilization and more confident in teaching BFIT exercises. Nearly all participants reported being highly satisfied, and many highlighted that BFIT gave them usable practical skills rather than abstract theory. What stood out was that students didn't just learn theory, they gained tools they could actually use. The cue cards, the scenarios, and the chance to practice communication made the learning feel real and relevant. Reflecting on these results and the broader issue of mismobilization, I would like to share what this means moving forward. Attending ICN conference reinforced that mismobilization is not just a Canadian concern, it is a global challenge. What stood out to me was that while BFIT is a structured mobilization program, the low-cost simulation used to teach it can be easily adapted across countries and educational settings. This study showed that BFIT is not only feasible and acceptable, but also practical for preparing nursing students to promote early mobilization. Moving forward, we need larger multi-site study to explore its broader impact. The ultimate goal is to embed BFIT into nursing curricula so students graduate ready to prioritize mobilization as part of everyday care. Attending the ICN conference was a truly inspiring experience. I gained a broader understanding of global nursing practices and saw how different countries are tackling similar challenges, including missed mobilization. I built meaningful connections with nurses, educators, and researchers from around the world and learned new strategies I can bring into my teaching and clinical practice. The sessions reinforced how nurses play a key role, not just in patient care, but also in leadership, education, and advocacy. I left feeling proud of our profession and motivated to keep pushing for change, starting with how we teach and support early mobilization. These are the key references. This was my e-poster at the ICN conference. Thank you for your time and attention today. I am grateful for the opportunity to share this work today in Alberta Wide Nursing Round, and I welcome any questions or feedback. Thank you.
Thanks so much, Zahra. That was excellent. Okay, up
And-
next, we have Alyssa Domingo.
Zahra is with us too, if
Oh,
we
yeah.
need to talk
Hello,
with her later
everyone,
about
and
this.
thank you.
Yeah.
Sorry, I couldn't catch that. Zahra, sorry, what did you say, Joanne?
Oh, I just said that Zahra is with us tonight online here. So if we need to talk to her later about her work, we can do that. Yeah.
Perfect. Yeah, maybe
Yeah.
Zahra will do some questions at the end if that works for you. Okay, up next, Alyssa Domingo is a registered nurse in the Eating Disorders Program and Neurosurgery at the University of Alberta Hospital, and she's a PhD student in the Faculty of Nursing. Her research focuses on aging, mental health, and community-based participatory and arts-based approaches to understanding the experiences of older Filipino immigrants in Canada. Alyssa's presentation explores how intersectionality can be integrated into gerontological nursing education to foster more inclusive, equitable, and culturally responsive care for diverse older adult populations. So go ahead, Heather, with Alyssa's video.
Hello, everyone, and thank you for joining us tonight for Alberta Wide Nursing Round. I'm very excited to share with you a presentation I gave at the ICN conference this June And this is one that speaks to a shift we can't really afford to ignore. So healthcare in Alberta is changing. Our population is aging. Yes, but it's also diversifying faster than our systems are adapting. And today, 1 in 5 Canadians is 65 or older, and many are from immigrant and racialized backgrounds. Seniors now outnumber children, and by the mid-2040s, the number of people aged 85 and older will triple. And as nurses, this isn't a future problem. This is our reality now. And it demands more than clinical competency. It demands critical thinking, cultural humility, systems level awareness. So let's talk about a little bit about triple jeopardy in aging. So with this demographic shift comes what scholars call triple jeopardy, the intersection of ageism, racism, and sexism that compounds health inequities in later life. A study by Dr. Salma and Dr. Salami shows us that Muslim immigrant and racialized seniors are especially impacted, facing everything from language barriers and isolation to overt discrimination in healthcare. So imagine an older immigrant woman in Alberta. Perhaps she doesn't speak English fluently, lacks family nearby, and faces both racial bias and ageist assumptions in the system meant to support her. I'm pretty sure a lot of nurses have seen this patient before. The result, she may delay care, distrust providers, or simply disappear from services entirely. And that's a human cost of ignoring intersectionality. So why is intersectionality, why does it matter in nursing? Intersectionality isn't a theory we keep in our journals. It's a tool we use at bedside as well. There's 2 questions really it asks. How do overlapping identities affect this person's care experience? And what barriers are visible on their chart? It forces us to abandon one-size-fits-all nursing. A care plan that works for a white, English-speaking Canadian-born senior may not work or feel safe for an Indigenous elder, a transgender senior, or a refugee even. Really, intersectionality helps us see the whole person and to ask better questions. That's how we build trust, and that's how we provide real care. So are we as a profession ready for this? Yes and no. National frameworks like CASN and CGNA have clearly laid out competency for person-centered, culturally safe elder care. And these standards exist, but many nursing programs still fail to meaningfully integrate them. Essential topics like ageism, dementia care, chronic illness, or how cultural and gender identity influence aging are often sidelined or optional. And that has consequences. Nurses are entering practice underprepared to care for the very population they see most. And many have never been trained to recognize how race or poverty shows up in elder care. That's not a knowledge gap, that's an equity gap. We can't keep treating gerontological nursing as a specialty. It is poor practice, and embedding it throughout nursing education is not optional, it's essential. And to ground this in lived values, I want to share the Filipino indigenous concept of kapwa, a word that means shared identity. Kapwa really invites us to view our patients not as others, but as extensions of ourselves. It's about empathy, mutual respect, and the radical idea that your well-being is tied to mine. In a 2022 study by Tursinova and colleagues found that Filipino immigrant caregivers used kapwa to navigate racism and foster healing relationships with elders, even within healthcare systems that failed them. So what could nursing look like if we embrace kappa? It would mean slowing down, listening, learning who our patients are outside their diagnosis, and treating them not as problems to manage, but as people to partner with. Kappa isn't just a cultural garnish. It's an anti-oppressive and globally relevant care model. And its values align with everything we say we believe in nursing, such as dignity, connection, and justice. So what does action look like? At the University of Alberta's Faculty of Nursing, we're trying to walk the talk. In terms of the curriculum, gerontology is no longer tucked into one course. It's integrated across undergrad programs from community health to pharmacology, with emphasis on ageism, chronic illnesses, and diverse aging trajectories. In research, honor students co-lead projects on aging, investigating real issues like isolation in rural seniors or cultural barriers in dementia care. And in the PhD program, there's a PhD course called Nurse 604. And students critically explore social and political dimensions of aging, including intersectionality and policy impact. In terms of community engagement, we center lived experience. Seniors and community partners help co-design learning so students don't just learn about older adults, they learn with them. It's not perfect, but it's a start. It's a proof that inclusive and intersectional nursing education can be done and must be done. So to end my presentation, let me leave you with this. Aging is not a burden. Diversity is not a challenge. The real challenge is whether we're willing to change how we practice, to ask deeper questions, to confront our own assumptions, and to care in ways that are slower, more intentional, and more just. Every older adult we meet has a story shaped not just by age, but by history, identity, and struggle. When we ignore that as nurses, we risk doing harm. But when we embrace it, we open the door to healing for them and for ourselves as well. So I invite you, reflect on your role, recommit to learning, and remember the concept of kappa, shared identity, shared responsibility. And that's the end of my presentation. Thank you so much for listening. I added my contact there. If you have any questions, please feel free to send me an email. Thank you.
Excellent. Thanks so much, Alyssa. I love that. It was amazing. Okay, we have one last presentation from a student. Nayaab Nadeem is a recent graduate from the University of Alberta's Honors Nursing Program and is currently working as a registered nurse at the University of Alberta Hospital. Her academic work has focused on advancing evidence-based nursing practice. Nayaab will be presenting the research she has been working on during her honors program, which was accepted as an abstract for the ICN. So go ahead, Heather.
All right. It's not sharing right now. What, can you see my screen? No.
No, not yet.
Hello everyone, my name is Nayaab Nadeem. I'm here today to discuss my research that was accepted to the ICN as an e-poster titled Utilizing Check-in Pulse for Mind-Body Wellness Programs for Adults Living with Chronic Health Conditions, which was an honors project completed alongside my partner Alyssa Domingo and supervised by Dr. Chiu and Dr. Ashley Hyde. So my research experience, I recently graduated from the University of Alberta Honors Nursing Program in June of 2025. I've been working on this project since my third year of nursing school, and I'm currently in the process of writing a manuscript for publication. We have had several of our abstracts get accepted, such as the Canadian Nursing Student Association's in Halifax of January 2025, where I delivered an oral presentation, as well as the Festival of Undergraduate Research and Creative Activities at the University of Alberta, and of course the ICN in Helsinki, Finland. So here's a picture of me and my abstract that was accepted to the ICN. So background, did you know that chronic health conditions are the leading cause of death worldwide? According to the Public Health Agency of Canada, older adults with chronic conditions often experience high stress, mental health challenges, and a lower quality of life. Mind-body wellness techniques like meditation, yoga, and cognitive behavioral therapy have been shown to reduce anxiety and depression while improving overall self-efficacy and overall well-being. The Empower program is a 12-week online mental wellness program designed for older adults with chronic conditions. It combines mind-body interventions to reduce anxiety and depression through two main components, life skills and energize. The life skill component uses acceptance and commitment therapy, featuring weekly videos and activities on topics like values, sleep, and pacing. Participants also receive short clinician videos with practical tips for managing chronic health conditions. The Energize component offers breathwork, meditation, and mindful movements such as yoga, tai chi, deep breathing, and chair exercises, with options ranging from 10 to 30 minutes. To boost engagement, the program includes gamified features like polls, points, badges, a leaderboard, and a community section. So this is a randomized control trial. Participants are randomized into 3 groups, one receiving weekly one-on-one check-in calls, another completing the program independently, and a third waitlist control group. Our research focused specifically on the participants who received the weekly check-in calls to explore how these interactions influence their engagement and overall experiences. So the larger Empower trial, as mentioned previously, we only worked on one control arm. For the largest study, the outcomes of interest were mental health, quality of life, fatigue, demoralization, frailty, and sleep. These are also the different tools we used to assess them. So the participant breakdown is as follows. The control group, which had 274 participants, the Empower group had 275 participants, and the Empower program with weekly check-in calls had 276 participants. We had various chronic conditions as well. And here's a graph of a breakdown of the chronic conditions. So you can see there's digestive disorder, cirrhosis, heart failure, post-transplant, PSC, and PBC. So purpose. Our goal was to qualitatively explore the impact of weekly one-to-one check-in calls on participants' experiences, adherence, and overall satisfaction with the Empower program. We wanted to explore how the check-in staff used motivational interviewing strategies and how the Empower participants responded to this. So check-in call details. The program calls were carried out by trained staff, including facilitators and members of the research team. Each participant received weekly calls over 12 weeks, with the content of each call aligned to the program's weekly themes. The duration of the calls varied from 5 to 45 minutes, although the intended goal was to keep them through around 10 to 15 minutes. This allowed for meaningful, personalized conversations while respecting participants' time. To ensure the quality and consistency of these interactions, staff received training in motivational interviewing. This included communication skills, demonstrating empathy, and fostering a supportive environment that encourages participants to engage and reflect on their progress. Overall, this approach combines structure with flexibility and aimed to create a positive, empowering experience for each participant throughout the program. Methods. For our analysis, we purposely sampled check-in calls from 25 participants. We selected participants based on several factors to ensure a diverse and meaningful sample. These included gender diversity, a variety of chronic conditions, different level of engagements ranging from 2 to 12 weeks of calls, and patterns of participation, including those who were consistent versus those with fluctuating involvement. All calls were audio recorded and transcribed using Otter AI to capture the content accurately. We then created a storyboard for each participant, which helped visualize the flow of calls and the topics discussed over time. Finally, 2 analysts conducted a content analysis focusing on the flow of calls, use of motivational interviewing techniques, and participant experiences throughout the program. This approach allowed us to deeply explore both the process and the impact of check-in calls while highlighting patterns across different participants' experiences. So results. In terms of demographics, there were 15 women and 10 men, which allowed us to capture various perceptions of the calls. Participants also represented a wide range of chronic conditions. So the number of check-in calls per participant ranged from 2 to 12 weeks, reflecting varying levels of engagement. This diverse sample helped us understand how participants interacted with the program and how their experience varied based on gender, health condition, and participant level. And here you can see the chronic disease types included. So PSC being 2 participants, heart failure being 2, PVC being 2, cirrhosis 2, cardiac event 2, mixed conditions 3, digestive disorder 3, post-transplant 4, CKD 1, fibromyalgia 1, and then mixed being 3. So perception of check-in calls. When we looked at participants' perception of the check-in calls, 3 key elements stood out. First, the calls provided a sense of accountability, helping participants stay on track with their goals and program activities. Second, participants really valued the emotional connection that the calls offered. They felt heard, supported, and understood, which contributed to a positive and trusting relationship with the program staff, such as participant 269's quote. Finally, participants described the calls as highly motivating and supportive. Many noted that the encouragement and guidance they received during these conversations helped them stay engaged and feel empowered throughout the program. Overall, the check-in calls played an important role in fostering motivation, accountability, and emotional support for our participants. Relationship building. During the check-in calls, interviewers used motivational interviewing techniques to guide conversations in a supportive way to match each of the participants' unique needs. They frequently help participants revise and revisit goals, ensuring that the program remained relevant and achievable for each individual. Participants consistently highlighted the empathy, active listening, and encouragement shown by the staff as key elements they valued most. These qualities help participants feel understood and supported, fostering a positive experience throughout the program. In addition, the consistent nature of the interactions help build strong rapport between participants and staff. This trust and familiarity promoted openness, allowing participants to engage more fully, share their experiences, and remain motivated over the course of the program. Overall, these relational approaches were central to the success of the check-in calls, supporting both engagement and meaningful progress. So, perceived impact on engagement. Participants reported several positive outcomes from the Empower program. First, they experienced improved confidence in applying mindfulness strategies independently, which empowered them to integrate these practices into their daily lives. The consistent relational support provided through the program also reinforced participants' commitment to their overall wellness, knowing that staff were regularly checking on and offering guidance helped participants stay motivated and engaged. Ultimately, it was a combination of relational support and the structured program design that contribute to sustained engagement. So, conclusion/implications. Individualized check-in calls play a significant role in enhancing the participant experience and encouraging consistent engagement throughout the Empower program. By tailoring the conversation to each participant's needs, staff were able to create meaningful interaction that kept participants motivated and involved. The use of motivational interviewing techniques further supported this process. These techniques promoted active participation and effective goal setting, allowing participants to take ownership of their progress and feel more confident in achieving their wellness objectives. Overall, providing personalized support reinforced the impact of digital health programs like Empower. It's shown that combined structured program content with relational participant-centered approaches can strengthen engagement, improve outcomes, and make the program more meaningful for participants. So acknowledgement. I would like to acknowledge the research team behind the Empower program, such as Anshul Brown, my honors partner, Dr. Jude Spars, and Dr. Ashley Hides from the Faculty of Nursing Primary Research Supervisors, Emily Johnson, and Dr. Panita Tandon from the Faculty of Medicine and Dentistry at the University of Alberta, who are the project leaders. So thank you so much. Please feel free to contact me at nayaab@ualberta.ca for any questions or comments. Thank you.
Awesome. That was so good. I wish I had gone to the ICN. I'm feeling so jealous now. Thanks so much for those fantastic presentations. So we now have a few minutes for questions, which is a bit tricky because we only have one of our presenters here, but I'm sure Joanne can answer some questions too. And then we can also forward them on. And then also we welcome any comments from anybody.
And we also have one more presentation by
do we?
Dr. Patrick Chiu.
Just
Oh,
before the
sorry.
note, yeah, yeah.
From him.
I'm the
So,
last to know. So we'll play
but while I find his, you can ask questions.
Yeah, please feel free to raise your hand or think of a question, and then we'll play the kind of closing remarks from Patrick.
Joanne, how did they determine who would get funding or who wouldn't, or did you just spread the funding? Because these were incredible from all
Yeah, we
levels.
actually did, we funded every graduate student and undergraduate who had their work accepted at the conference. Yeah,
That's
so
awesome.
yeah, we decided that already the process of getting into the program at ICN is quite rigorous. So that
Wow.
was our way of determining who would be funded.
I'm
What
so
a great use of funds. Yeah.
I'm so jealous that I had a poster accepted to the ICN the year before and I didn't get to go. I'm so sad.
Okay, I'm
Oh,
going
well.
to try to get into this one here, but I'm having problems getting it unmuted, but let's see.
Okay, I think it looks good now.
So to close the session, I wanted to talk a bit about the GNLI, the Global Nursing Leadership Institute program, as there may be some nurses in senior leadership positions across the province that may be interested in exploring this very unique opportunity. So I had the privilege back in 2017 to be selected among 30 nurses to participate in the Global Nursing Policy Leadership Institute. That year they added the word policy into it. Since then, it's been dropped, but the program still heavily focuses on policy leadership. And this was a year-long program that consisted of 3 modules, one being a 1-week residency in Geneva. And for me personally, this was the beginning of my passion for global nursing, global health, my journey towards policy leadership. And through the program, I developed the knowledge and the connections to shape global public policy in several ways, as an academic doing research, as an independent consultant supporting government and nursing organizations, and also as a teacher by cultivating that global mindset among my students. Through this experience, I also had the opportunity to serve as a United Nations liaison to the Economic and Social Council for another global nursing organization, Sigma Nursing. So these are just some photos that I put on the slide here of my fellow GNLI colleagues who we still talk to this day. We actually just had a meeting a couple of weeks ago, and it's really been a great opportunity for me to maintain those connections with global nurse leaders. I should also mention we're really lucky to have 2 other faculty members affiliated with GNLI. Dr. Jordana Selma was a participant last year, and Dr. Salima Meherali is actually a participant of this year, of the 2025 cohort. So that really shows the strong expertise that we have and continue to have in our faculty in order to advance global nursing as well as our own global nursing office. So for those of you who are interested in the program, essentially it's a strategic leadership program aimed at strengthening global nurse leaders' political and policy understanding and influence. As I mentioned in the previous slide, around 30 nurses are selected each year. The program changes slightly each year, but typically it is a year-long program that includes some work prior to a week-long stay in Geneva, followed by completion of group projects that is focused on the priorities of WHO regional offices. So for example, the GNLI 2025 program for this year focused on the United Nations Sustainable Development Goals, health disparities, gender equity, as well as universal health coverage. Also a considerable focus on the global strategic directions for nursing and midwifery. And also a very heavy focus on the WHO regional offices and their priorities. So the year-long program is designed to support scholars to think locally and act globally. And there is now a growing network of GNLI alumni who are collaborating on a daily basis and also thinking about different projects that we can do in the future collaboratively. So it's really truly a wonderful network to be part of. So if this is something that you're interested in, I would highly recommend you look into it. You can find more information on the ICN website. And if you have any questions, we'd be happy to provide more information as well. So thank you so much for attending this session today. Hopefully you found some of our insights illuminating. Special thanks to our students who provided their insights and experiences and lessons learned. And we hope to be able to have more nurses join us at the next Congress in Taipei. Thanks so much.
Great. Okay, so I think that's the end of our presentations. Do we have any questions or comments or anything before we say goodbye? Okay, well, thanks so much to our presenters. The student presenters were so excellent. Oh, I'm so happy and proud of them. And thank you all for joining us today. This session has been recorded. So please visit our website to see recordings and announcements. And I think, Usha, are you going to put that in the chat or should I? Got it? Perfect.
You want to also promote the next one that's coming up in November?
Yes, for sure. So for our next Alberta-wide nursing rounds is going to be on Tuesday, November 18th at 7 p.m. And the topic focuses on children's health. So Dr. Shannon Scott and her colleagues will share their research insights related to children's health. So please register. And then I think Usha will put that registration link in the chat. So you might as well just register now.
I think Gina has raised her hand.
Oh, sorry. Gina.
Oh, sorry, I didn't even know I did, but thank you. This was really inspiring. All the presentations were so informative and I loved all of it. And I really particularly love seeing that how our faculty is really representing, the nursing profession and discipline at the international level. And I hope that I can be a part of, this 2026, I guess, ICN Congress in Taipei. So, because I'm planning to submit like a couple of abstracts. So yeah, fingers crossed. And thank you so much for this nursing rounds today.
Great. Thanks so much, Gina.
It's actually 2027, so you have over a year to get ready. Yeah.
Yeah, absolutely. I am currently working on a scoping review on traditional Chinese medicine and how that's being used in children's pain management with Dr. Samantha Louis-Pun from our faculty. So I think by the time I'm pretty sure the scoping review would be done and I'll be able to submit an abstract for that. I'm so excited.
Wonderful. Yeah.
That's amazing. I'm excited to read that. Very cool. Okay, so I think everybody has the links that we suggested. Yeah, so please register for the next rounds and we'll see you on November 18th. And it was lovely to see you all again.
Thank you so
Lindsay.
much.